When we talk about zip codes determining outcomes, what we're talking about is the fact that, are your sidewalks good so that you can go out on a walk? Do you have lights so that you can see the path? Do you have green spaces so you can enjoy time with your children? Do you have access to a gym? Do you have access to healthy foods? Do you have access to jobs that give you health care, health insurance, so that you can actually go see a doctor? And then when you go see that doctor or that physician, do they care enough to take down their biases, take down what they think about the world, and treat you like you deserve to be treated? That is what we're talking about. And so when I'm passionate about health equity, because 11 years ago, my grandma died because she needed a double bypass, and my grandfather was not the best to her. We grew up in an abusive household and that. And in Puerto Rican culture, oftentimes they looked to the man. So when she went with heart pain and chest pains to the doctor looked to the guy, looked to my grandfather, and then he sent her home, and she died that night. So when we're talking about health equity, we're talking about, as a physician or as a nurse or anyone who is working with people in the community, you don't need to just be a nurse. You could be a community health worker. You could be a community organizer. What do you come into that space with? What biases? What stereotypes? What understandings of the world do you come into that space with that then influence the decisions that you make? We have heard too many times that people go in asking, and they're like, I know something's not right. I know something's not right. But then the doctor turns them away and says, no, you're fine. Your blood work's good. They don't listen to them. They don't trust that they have full autonomy over their body and that they know their body better than any physician ever would. Yeah, they have the degree, but they don't live with them every day, right? They're not that person. So that's why I'm passionate about health equity, because I believe that my grandma would still be here today if that physician didn't come with that cultural misunderstanding, if he had listened to her and not my grandfather, right? So